Imagine your body gradually sending messages. Your hands and feet become more sensitive to the cold, your eyes and mouth dry out, a persistent cough bothers you, and sometimes hip pain or gastrointestinal issues make daily life difficult. These can be signs of Sjögren syndrome, a complex autoimmune disease that affects the body's moisture-producing glands and can involve the nervous system, thyroid, digestive system, and even the prostate. Research shows that about 0.5 to 1% of the global population is affected by Sjögren syndrome, with women aged 40 to 60 at the highest risk. In Sjögren syndrome, the immune system mistakenly attacks healthy tissues, leading to dry eyes and mouth, circulation problems, nerve pain, and multisystem complications. Recognizing early symptoms, timely diagnosis, and careful management of the disease are key to preventing serious damage and improving quality of life. I want to introduce you to 6 important signs of Sjögren syndrome, signs that your body is quietly warning you, and if you pay attention to them, they can be the key to early diagnosis and prevention of serious complications. These symptoms are like pieces of a puzzle that, when put together, reveal the true picture of the disease and help you gain more control over your health. 1. Peripheral neuropathy, when your hands and feet become numb. Peripheral neuropathy is one of the lesser-known but significant complications of Sjögren syndrome that can severely impact quality of life. This condition arises from damage to the peripheral nerves, which transmit information between the brain, spinal cord, and body organs. In Sjögren syndrome, the immune system mistakenly attacks these nerves, causing inflammation, pain, and disruption in the transmission of nerve signals. Patients often describe their symptoms as tingling or numbness in the hands and feet, burning or itching sensations, nighttime pain that disrupts sleep, muscle weakness, coordination problems, and altered sensitivity to touch or temperature. These issues typically start gradually and can sometimes remain undiagnosed for years, as patients attribute them to fatigue or circulation problems. Diagnosis of this condition usually involves a neurological examination by a neurologist and tests such as electromyography, EMG, and nerve conduction studies. Treatment includes managing the underlying condition, medications to reduce nerve pain such as gabapentin or pregabalin, physical therapy to maintain strength and balance, and lifestyle and stress management. Peripheral neuropathy can make daily activities like walking, holding objects, or even wearing shoes difficult. With timely diagnosis and appropriate treatment, pain and discomfort can be reduced, improving the quality of life for patients. 2. Thyroid problems in Sjögren syndrome, when your body is always tired. For many individuals with Sjögren syndrome, fatigue is not just a common feeling. Imagine waking up in the morning with cold hands and feet, lacking the energy for daily tasks, and even gaining weight despite the same diet. Your hair becomes brittle, your skin dries out, and you notice mild swelling in your neck. These could be signs of thyroid involvement, particularly hypothyroidism or Hashimoto's thyroiditis, which is an autoimmune disease in itself. In Sjögren syndrome, the immune system may attack the thyroid gland, reducing the production of vital thyroid hormones. These hormones are responsible for regulating the body's metabolism. A decrease in their levels can affect energy, weight, body temperature, digestive function, and even mood. Common symptoms include chronic fatigue and weakness that do not improve with rest, unexplained weight gain even with a normal diet, hair loss and dry skin, increased sensitivity to cold hands and feet, mild to moderate constipation or gastrointestinal issues, mild neck swelling, enlarged thyroid gland or goiter. In some cases, depression or decreased motivation. These issues can complicate other Sjögren symptoms. Fatigue and weakness, dry skin, decreased energy, and even dry eyes and mouth may arise from both Sjögren's itself and hypothyroidism. Who is at greater risk? Women with Sjögren's experience thyroid problems more often than men, but men can also be affected and are often diagnosed later. Individuals with a family history of autoimmune diseases are at higher risk for this issue. Diagnosis: blood tests to check thyroid hormone levels, TSH, T3, T4, testing for thyroid antibodies, anti-TPO and anti-TG, to diagnose autoimmune thyroiditis. Physical examination of the neck and, if necessary, thyroid ultrasound. Management and care: taking thyroid hormone replacement, levothyroxine, as prescribed by a doctor to regulate hormone levels. Regular follow-up tests to monitor thyroid status. Maintaining a healthy lifestyle, including proper nutrition and stress management. Paying attention to warning signs such as severe fatigue, sudden weight gain, or neck swelling. Early diagnosis and appropriate care can significantly improve the quality of life for Sjögren's patients and prevent long-term complications. This aspect of the disease, although less visible, is very important and should always be taken into consideration. 3. Chronic prostatitis. Men with Sjögren syndrome may experience chronic non-bacterial prostatitis, which can be considered the male equivalent of vaginal dryness in women. This condition involves long-term inflammation of the prostate without the presence of bacteria, leading to chronic pelvic pain and urinary problems. Research published in Prostate Cancer and Prostatic Diseases shows that men with Sjögren's experience a higher rate of prostatitis compared to the general population. Patients may experience deep pelvic pain that radiates to the back, testicles, or thighs, often worsening with sitting, activity, or stress. Pelvic pain may radiate to the back, testicles, or thighs and can intensify with sitting, activity, or stress. Unlike bacterial prostatitis, antibiotics have no effect, and the pain may persist for months or years. Urinary symptoms include frequency, urgency, weak urine flow, and nocturia. Sexual problems are also common: painful ejaculation, decreased libido, or erectile dysfunction, which significantly affects quality of life. The International Journal of Impotence Research reports that chronic prostatitis in Sjögren's patients often remains undiagnosed for years, as urologists may not consider the autoimmune cause. Men with chronic pelvic pain, especially if accompanied by dry eyes or mouth, should be evaluated for Sjögren syndrome. This condition occurs only in men and may be an initial sign leading to a diagnosis of Sjögren's, especially in those who might overlook mild Zika symptoms. What can you do? If you experience chronic pelvic pain or urinary problems, consult a urologist and an autoimmune specialist. Managing stress and reducing prolonged sitting can help decrease pain severity. Paying attention to symptoms of body dryness can assist the doctor in making an early diagnosis. Sjögren syndrome does not only affect the eyes and mouth. Many patients initially experience gastrointestinal problems. Studies show that up to 70% of Sjögren's patients have significant issues in the digestive system, with gastroesophageal reflux being the most common. Because saliva production decreases, leading to difficulties in the initial stage of digestion. Food is not properly broken down, allowing stomach acid to more easily reflux into the esophagus. Patients describe this sensation as severe heartburn, food returning to the mouth, and the feeling of food getting stuck in the throat. The lack of protective saliva causes stomach acid to damage the esophageal tissue more quickly. Another issue is gastroparesis. The stomach empties more slowly, causing bloating, nausea, and even vomiting, and it often remains undiagnosed for years. Some patients even develop autoimmune pancreatitis, which can lower enzyme levels and increase the risk of diabetes. Women report these symptoms more frequently, but men can also experience serious problems. Both genders should take these symptoms seriously and seek specialized care if needed. If you experience heartburn or food regurgitation, see a gastroenterologist promptly. Eat smaller, lighter meals. Avoid foods that trigger stomach acid, such as fatty, spicy foods and carbonated beverages. If you have chronic nausea or bloating, medical follow-up is essential to diagnose gastroparesis or pancreatitis. 5. Dry eyes, keratoconjunctivitis sicca. Dry eyes are one of the most prominent and well-known symptoms of Sjögren syndrome, but many attribute it merely to aging or excessive use of mobile phones and computers. The reality is that for those with Sjögren's, dry eyes are a serious and significant sign. The medical term keratoconjunctivitis sicca refers to the simultaneous inflammation of the cornea and conjunctiva due to insufficient tear production. Research published in the Archives of Rheumatology shows that Sjögren's patients not only produce fewer tears, but the chemical composition of their tears has also changed. This means that the eyes become more vulnerable to dryness and infection due to a lack of natural protection. Patients typically describe feelings of burning, dryness, and the sensation of tiny particles resembling sand under the eyelids. The eyes may appear red and sticky, especially in the morning and after sleeping. Unlike temporary dryness caused by environmental factors, dry eyes related to Sjögren's persist throughout the day and worsen in dry, windy, or poorly ventilated environments. If this inflammation is left untreated, it can progress and lead to more serious complications, including damage to the cornea, corneal ulcers or scarring, vision loss, And, in rare cases, corneal perforation. Gender plays a role in this issue. Women report these symptoms about 9 times more than men, but research indicates that men may report initial problems less frequently, and by the time they see a doctor, their eye damage is more advanced. Therefore, early diagnosis and regular monitoring are vital for both genders. What can you do? Regular use of moisturizing drops or artificial tears to reduce dryness and protect the eyes. Avoid prolonged exposure to dry or windy environments. Maintain an appropriate distance from screens and take regular breaks for the eyes. See an ophthalmologist if dryness, burning, or redness persists to prevent permanent damage. With timely care, serious complications can be prevented, and the quality of life for patients can be significantly improved. 6. Raynaud's phenomenon. Imagine dipping your hand into a glass of ice water or going outside in cold weather. Suddenly, your fingers first turn white, then blue, and finally red, accompanied by a burning sensation and tingling in all your fingers. This is what is known as Raynaud's phenomenon. About half of the people with Sjögren's syndrome experience this issue. In this condition, the small blood vessels in the fingers and toes temporarily constrict, usually triggered by cold or emotional stress. These attacks typically last from a few minutes to several hours and can be extremely painful. In severe cases, frequent attacks may lead to ulcers on the fingers or even permanent damage to the fingertips. The pain can be so intense that writing, typing, or even holding cold objects becomes difficult. The color of the fingers usually changes in 3 stages. First, they turn white due to the cessation of blood flow, then blue due to a lack of oxygen in the blood, and finally red when blood flow resumes. These attacks can last several minutes to hours and can be very painful. Patients experience numbness, tingling, or burning sensations. The presence of Raynaud's phenomenon usually indicates more active autoimmune disease and may involve other organs such as the lungs and kidneys, making medical monitoring important. This issue occurs in both genders but is slightly more common in women. Men with Raynaud's may experience more severe vascular complications, so care and protection of the blood vessels are essential. The good news is that the severity of attacks can be reduced with a few simple measures. Keep your hands and feet warm. Avoid sudden temperature changes and extreme cold. Try to manage stress and maintain calm. Understanding Sjögren's syndrome and its symptoms can make a significant difference in quality of life. By being aware of the signs and paying attention to the body's warnings, this complex disease can be diagnosed earlier, and long-term complications can be prevented. Each symptom, from dry eyes and mouth to nerve pain or gastrointestinal issues, is an important message from the body that should not be ignored. With regular medical follow-up, lifestyle changes, self-care, and symptom management, Sjögren's patients can lead active and healthy lives. If you found this video helpful, don't forget to like and leave a comment. See you in next video.